Hello, I guess if you're watching this, you've either been told you have plantar fasciitis or you're suspected to have plantar fasciitis. And what we're here to talk about today is how to try to manage with the discomfort. Because this is a condition that generally recovers over a period of 9 to 12 months without any surgical intervention. And our goal in treatment is to keep the pain under adequate control so that you can put up with it for the length of time that it takes for it to recover. The plantar fascia is a ligament that supports the arch of your foot. It starts at the heel, underneath the foot, in the back, and extends forward to the toes. And it helps support the arch of your foot, much like the string on a bow and arrow keeps the bow bent. If your plantar fascia is hurting, it's probably because it's starting to tear a little bit. And it's a tearing that doesn't come from trauma, but it's something that happens with degenerative ligaments, and kind of like tennis elbow, some of these conditions that take a while to recover. Our goal is to manage your pain reasonably well for the length of time it takes for Mother Nature to resolve the problem. Things for you to work on to keep the pain under control. Step number one is identify activities that aggravate the symptoms. If you were off your foot all the time, the pain would get better, but it's unreasonable to expect you to be off your feet all the time. But if there are certain activities during the day that you have found aggravating to the pain, then avoiding those things is a reasonable thing to do. If the activities are important enough for you to continue, whether it's work or play, continue to do it. Just understand that you'll have more discomfort when you do those activities. So simple activity modification is one step. Second step are things that you can do with shoes. In general, a softer shoe is more comfortable than a harder shoe. A shoe that has some stiffness in the toe box, that doesn't allow your toes to bend so much when you're walking, pushing off on your foot, is more comfortable than a shoe that's very flexible, that allows for a lot of bending. Shoes that have a little bit of a heel. This works better for women than men, but shoes that have a little bit of a heel are usually more comfortable than flats. Thirdly, medication can take some of the pain away. There are two types of pain with plantar fasciitis. There's the sharp pain that you get when you first arise in the morning. There's also an aching, throbbing type of pain that you may have it later in the day, even when you're off your feet. Ibuprofen or naproxen, two drugs that are available over the counter, can do a lot to help with that pain, but it generally helps with the aching, throbbing pain more than with the sharp pain. The most important way of managing the pain is with a stretching program. The problem with the stretching program is that you don't get any immediate improvement. You have to do the stretching for several weeks before you even notice the improvement. The stretching only takes 30 seconds of your time, but it should be done frequently throughout the day. If you do the stretching 6 to 8 times a day and it only takes 30 seconds per stretch, then you're doing a good job of stretching. I want to show you the technique of stretching. You need a stool or a stairway. You get up on the stool or the stairway with both feet. The foot that you want to stretch goes off the back of the stair with your knee straight. Bend the opposite knee, drop the heel down, and that's the stretch. You'll feel the stretch mostly in your calf muscles, but it's also stretching the arch. After 30 seconds, you go about your business, and then an hour or 2 or 3 later, you stretch it again. Stretching the plantar fascia is the most important way for helping you control the pain, but again, don't give up on the stretching after 2 or 3 weeks. If the stretching program, shoe wear modifications, activity modifications, and medication doesn't control your pain adequately, certainly it's reasonable for you to come in to have it checked out for considering further options.